It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest-running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider who gives me street cred with the whack alternative medicine assets. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacey. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347.
Boo-head.
Visit our website at Dr. I don't think anybody could have understood that, but that's fine. After 20-some years, surely they figured it out by now. Visit our website at drsteve.com for medical news, podcasts, and stuff you can buy. I can't mention contractually. Most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. Good. Oh, that was a great intro. Anyway, check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And, Jim and Sam have entered the Dabbleverse.
Cool.
How exciting for them.
Well, Rich Voss made the mistake of making a joke on Twitter when Chad Zumach and Stuttering John were talking about gigs. And Rich said, I thought you guys were enemies. I can't keep track of all this middle drama. Now, when you call somebody a middler, that means, they're not a headliner. That's somebody that goes between the host and the headliner. And John got extremely offended by that. Again, to the point where if this had been the original thing, we'd be talking about the middle verse, not the dabble verse. But, he got mad that, I've been headlining. He started showing Rich, who was just being an ass. He does this to everybody. He calls everybody a middle. John started sending pictures of him headlining at all these places. Of course, they were all from 10, 15 years ago or whatever. And Rich was just laughing. So they talked about it on My Wife Hates Me, which is still one of my favorite podcasts. And then Rich was on Jim and Sam. And Sam brought it up, said, you're in the Dabbleverse. It turns out that Sam Roberts knows pretty much everything about the Dabbleverse. He's been following it all this time. So he's too highfalutin to go on maybe WATP or something like that. But we might be able to get him on our Patreon show as one of the exam room guests. He's not too big for that. And wouldn't it be fun if we could get him to Rochester for DabbleCon too? So we'll work on that. But anyway, that's big. So now the Dabbleverse has expanded to these other things. I'm going to be at Hackamania May 31st through June 2nd. Check out your tickets there. It's hackamania.com's offer code Cardiff, I believe, is the correct offer code for that. So anyway, all right. You got anything for us today, Dr. Scott?
Nope.
Tacey, you ready for some topic time?
Sure.
All right.
It's Tacey's time of topics. A time for Tacey to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacey.
Well, hello. To the most boring part of this episode.
That's the things that are coming out of your mouth, Todd. Babbling. Insanity.
Yeah, okay.
Delusion.
So that's enough of that. So I'm going to go over a couple of weird diseases here.
Okay.
The first one is congenital insensitivity to pain. This disease is present from birth, which inhibits the ability to perceive physical pain. It is caused by mutations in specific genes, particularly in an autosomal recessive pattern, which is 2 inherited gene mutations,
Right.
one from each parent.
Right.
People with
Both
this-
parents have to have the gene for this to be expressed.
Yes. People with this condition can feel the distinction between a sharp and a dull object and something cold or hot. However, one cannot sense that the hot beverage is already burning their tongue. Unfortunately, there is no known cure for this condition yet.
Do they say what the mechanism is for this?
No, they just say symptoms include loss of smell and decreased ability to sweat.
Okay, because so yeah, a lot of these
Sweating.
genes do lots of different things.
Mm-hmm.
But if we could harness this, I could maybe stop prescribing so many opioids for cancer pain.
Yep.
If we could figure out what it is about those people, and they're rare, that causes them to not perceive pain. Because, that's a big part of my job.
Oh, gosh,
and
yeah.
then the opioids are, they're an issue. And we have lots of chronic pain patients out there that are having difficulties with, getting opioids and stuff like that. If we had something like this that was, say, non-addictive, but allowed patients to live their life without feeling pain. Now, my question, Taste, does it say anything that those people walk around with wounds all over their feet because they can't tell?
No, it doesn't say. I read you everything that it said.
Okay, because, people who have neuropathy
Right.
that cannot feel pain, say, in their feet, get these things called Charcot joints, and it's just a cumulative number of microfractures because they can't tell that they've injured themselves, so they just keep injuring themselves. That's a different thing. These people can actually tell the difference between sharp and dull. So I suspect they're walking around not having a bunch of wounds. I've never seen anybody like this.
Oh, no, yeah.
It's so rare that it's just not something, and they didn't teach us about. But I'd like to learn more about that. Will you put that down for research for next time?
Sure.
We always say we're going to do that,
And we never do.
and then we never do it. But we,
I was thinking too, though, what would be really, really, really interesting if they don't or do feel visceral pain,
Right.
Because that's one of the hardest things that we treat,
right.
Or organ-related pain, as opposed to, a stab or a cut or a broken bone, But organ-related pain is really kind of challenging to treat.
Yeah, and that's okay. Now, this person, here's case presentation. A 12-year-old boy presented with chronic osteomyelitis, so that is infection in the bone. He was the fifth child of a consanguineous couple. That means they were related. They say Upper East Tennessee is the center of tranquility and consanguinity. Yes,
right.
so in his birth history, he had a low APGAR score, blah, blah, blah. Okay, let me see. He had no reaction to pain, could not feel pain or heat. Brain CT and lumbar puncture findings were normal. They did a bunch of things, different tests. He had some mental, deficits.
yeah.
So, but he had an infection on the sore on the heel of his foot that was wide open. So this guy, at least, had a wound that
He could not
he
feel.
couldn't feel, and so he was just walking around on this giant wound. Now, here's somebody with a 13-year-old girl had a deep sore in the heel of her foot. I'm translating from medical terminology to normal human speech. And she suffered from absence of normal reaction to pain. She occasionally had convulsions, high fever, and et cetera. So she had this harmful deformity in her heel, and antibiotics were ineffective. They did an amputation. So, yeah, some of these folks that have this have fractures and things that they're just walking around on. So it's not a great thing at all. And it's called CIPA, as Tacey said, congenital insensitivity to pain, and anhidrosis, meaning that they don't sweat, which also puts them at risk for heat stroke. Because if you don't sweat and you have very little mechanism for cooling your body down, if you're out in the heat, you can die from that. So, all right, it says here, they must regularly visit their doctor to receive a full workup to be sure that they don't have any insensitive internal problems, as Scott was saying. So I'm going to give both of you a bell on this.
Give thyself a bell.
That can be
Doesn't
fatal.
matter. It's even now.
There's 60 documented cases in the United States, so very rare. Wow.
That's pretty rare. That's crazy.
Yeah, the reasons for death among patients with this condition are things that could otherwise be treated. A heat attack is much more dangerous for them because they don't feel it. and they often experience trauma, bony fractures, and osteomyelitis because of insensitivity to pain. So, yeah, that's unfortunate. It would be nice, but still, if we could turn on an insensitivity to pain, if we could figure out what the mechanism is for people short term, either post-operatively or people with cancer that have severe debilitating pain, that would be a great thing. So that's these folks are, a topic for research, further research. All right, very good. That's a good one, Tace.
Good one,
All right,
Tace.
what else you got?
Alice in Wonderland syndrome.
Uh-oh.
This neurological syndrome is called the Todd syndrome. It usually presents migraines that can distort a person's body image, including the size of the head, hands, and feet. Patients can also experience hallucinations and the feeling of time passing by either slowly or quickly. Sadly, Alice in Wonderland syndrome has no proven effective treatment yet. However, a treatment plan consists of migraine prophylaxis and a migraine diet may help.
Wow. Yeah, they're saying the most common treatment for this is a migraine diet. What the hell's a migraine diet?
I don't know.
No chocolate,
Nothing
good.
no red wines.
Yeah.
All the good stuff. Probably would eliminate alcohol and everything.
Well, it says, okay, half your grains should be whole grains. Vinnie Tortorich wouldn't like this. Fruits and vegetables, healthy fats, magnesium-rich foods, reduced red processed meat, and carb intake. Yeah. Okay, interesting. All right.
Very interesting.
That sounds, I bet that's pretty half-assed in its, in its response to
Anything.
Alice in Wonderland syndrome. But anyway.
Yes, they could have come up with a better name, I think, to make
Yes.
it sound a little
Well,
more-
but I mean, this diet, it's just a normal diet.
yeah, not a healthy diet.
Go eat a normal diet. Well, it is true. If the rest of America is like our child, then he is not eating a normal diet.
Right. Crazy.
I mean, Zaxby's. We should buy stock
21
in
years
fucking
old now.
Zaxby's.
Oh, I know it. I know it's insane.
Yep, Liam, the little kid from the Ashley Madison commercial, is now 21. It's nuts.
It's hard to believe, isn't
Yeah.
it?
All right. go
Okay.
ahead.
Hutchinson-Gilford progeria syndrome.
Okay.
Jerry, okay.
It's an extremely rare condition wherein a person goes through a rapid appearance of aging beginning in childhood. Oh, are these little people they used to put on talk shows?
Yes.
Yes.
Okay. It occurs in 1 in 4 million with more than 131 cases reported in scientific literature globally since 1886. They have alopecia, aged-looking skin, brittle, fragile bones, kidney failure, joint abnormalities, loss of eyesight, and loss of fat under the skin. No cure.
Yeah.
Yeah.
Yeah, that's a rough one. They don't live very long either.
Yeah, this says there is no cure. However, in November 2020, the FDA approved lonafarnib, a drug that can help
Lonarfinib.
reduce the risk of death due to the disease.
Really? Mm-hmm. Okay, I'm
So
going to look at
Kenvy.
that. While I'm looking that up, I was going to, since it is Liam's birthday, I thought playing his Ashley Madison
Yes,
voice
please
track
do.
would be
That
good.
is the best.
When my mom is a my daddy goes to ashleymadison.com. There he can lots of other women. When I grow up, I'm going to be an Ashley Madison man. Because my daddy's raising me without any moral compass whatsoever. Ashley Madison, find your lovers here. Why exactly are we singing this? Daddy, what's a rotisserie?
Oh, anyway, good boy.
God, I love that
He
one.
was a good boy. Back then, he'd say anything I told him to say.
Back then, he was good.
Not
Yeah.
so much now.
No.
And he, there's one bit I'd love to play is the feud between him and Dave McDonald.
But it got out of hand
It
quite
got
quickly.
so out of hand because they were doing sort of a wrestling thing. Now, look here, McDonald, because it started with Dave McDonald saying that Liam kept touching his daughter's head when they were here. He's like, stop touching my daughter's head. So then Liam did a response, and called him a doo-doo head or something. And then Dave was like, no, you do not call me a doo-doo head. You can call me, and then all these horrible things, but not a doo-doo head. And then it was off to the races. And Sam and I was talking and said, this is a really kind of a fun bit. We could do some stuff with this. And then all of a sudden, on one of them, Dave on his show, which I think was it special, what was it called? Special Delivery.
I don't remember.
Started saying, Liam, have you ever had sex? Now, at this point, Liam was 7. And he was talking about how the things he was going to do to Liam that were in a sort of sexual, realm.
Oh,
and
no.
it was like, E-Rock called me and said, you got to stop the bit. I mean, Dave ruined it. It got really bad.
It
really
got
bad.
really bad. And I was getting calls on it, and I'm like, I don't have anything to do with it.
Right. But yeah, Tacey's friends were calling her. It's like, what the hell is going on with this thing? So yeah, we had to stop.
Yeah, we had to stop.
It just, he was 7. But anyway.
Well, and Dave should have known better. I don't know
He
what
did.
he was thinking.
He was being funny, and he is funny. I just talked to him the other day. He's doing very well.
Good.
And he got invited. He's a smart man. He's got a real job, and doing radio in a real market. And he was invited on some show, and he was like, you know what? Nah, I'm kind of out of that business now. I've got to be an adult now, and so he is. So I'm very proud of him.
Good.
Yeah. Dave, there are times that he's made me laugh harder than any other human being on this earth.
Yeah, he is quite funny.
So.
Cool.
I've got 2 more real quick ones. And then I've got the thing you sent me, but
Okay.
I feel like we've gone on a little long.
Yeah, okay. Yeah, that's fine.
Alkaptonuria.
What?
Alkaptonuria.
Yeah.
Also known as black urine disease.
Yeah.
Inherited disorder that results in a buildup of chemical called hemogentisic acid in the body, staining the tissues dark.
Are you talking about alkaptonuria?
Yeah.
Okay, very good. All right.
In addition, the condition prevents the body from entirely breaking down 2 amino acids called tyrosine and phenylalanine
Yeah.
that are responsible for body pigmentation. Sadly, there is no treatment cure for this condition yet.
Yeah. Yeah, so it's a deficiency of the enzyme homogentisate 1,2-dioxygenase. So there you go. And it's just weird, we have all these enzymes. If you're missing one, it'll have these effects, and this is the effect of this one, is it gives you black urine. Are there any downsides to having black urine, Tace?
No, but there's no treatment for it.
I know, but do we care? The reason is there are some long-term effects of this. When people with alkaptonuria get into their 30s, they start having joint problems.
Okay.
And so they'll have low back pain, stiffness, and then their hips, knees, and shoulders. And, you see people with osteoarthritis at a young age. I've never asked them if they have black urine, but I would assume that they would have
tell
told
you.
somebody.
Yeah, you would think.
But it makes their cartilage brittle. That is what it does. Now, they may develop brown spots on the whites of their eyes. That would be a way to pick that up. So if you're looking in someone's eyes and you see a brown spot on the sclera, the white part, you could say, hey, is your urine weird?
Pea black, yep.
Yep. And the earwax would be black.
Oh.
Yep. They may have, because the bones and muscles around their lungs become stiff, they may also end up with trouble breathing, and then they can have discolored sweat that stains the clothes, and they could have blue places on their skin. There's all kinds of stuff just because of this one enzyme.
Jeez.
Isn't that crazy?
Isn't it wild, yeah.
Yeah.
Okay, the last one is a parasitic twin. That happens when one of the fetuses stops developing during pregnancy. The parasitic twin is attached to the other fetus and can grow recognizable body parts. To this date, there are still rare documented cases of this phenomenon for researchers to study.
Wow. I was trying to think of twins that I could make a parasitic twin joke,
I mean,
but I couldn't think of anybody.
You hear of twins absorbing
the
the
only
other
one.
twin.
Fucking idiot.
But they're not twins. So.
Like,
Yes. Say that again, Tay. Sorry.
you hear of one twin absorbing the other one.
Correct, and that's actually inside their body. Now,
I think there was an X-File about that one time.
really?
Oh, yeah.
Yeah. And then one was controlling the other from the
Yes.
inside.
And it was pretty cool.
The call's coming from inside your body.
It was pretty cool. It actually would crawl out of the dude at night.
Oh, really? Oh, really?
Yeah, and would go around wreaking havoc.
And then crawl back in.
Yeah, it would crawl back in and be like, who's, it was like part of a freak show. Who tore up the bathroom last night? Well, I don't know.
And then it's this, if it's an identical twin, it had the same DNA, so the guy would get blamed.
He was
for
blamed for it. So what happened? He was blamed.
Yeah.
For it. It was crazy. It was cool.
That's funny. All right. Well, are we ready to do some phone calls?
Yes, and I'm ready to time you.
Oh, you're going to.
Oh,
okay. Yeah.
shit.
Number
All right,
one
we
thing,
gotta work at
don't
this.
take advice from some asshole on the radio.
We can do it. We can do
Okay.
it.
You ready?
We can do it.
Wait.
I'm loose.
No, I'm not waiting.
I'm
Here.
loose.
Okay, let's go.
Hey, Dr. Steve, this is Bill in Texas.
Hey, Bill.
I talked to you in the past about my kidney stones, and
Yes, sir.
you're a very big help to me, and I appreciate it. But I got a serious
Hey, thanks,
question. Do we sneeze when we sleep?
Oh,
Thank
that's
you
a
for your
good question.
assistance. I appreciate it. Have a good day.
That is a good question, and I know the answer to that. Do you have any insights on this, Dr.
So
Scott?
the answer is we do not. For the most part.
Okay, so during REM,
What kind of an answer is
it's
that?
partially right.
That's a partial. That's more of a bill than you
So
get.
in other
you
words,
shithead.
the answer is
I get a partial bill. By God. Yes.
Lord and lady, douchebag.
If you're in deep sleep, you do not sneeze.
Blah, 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 blah. See, that's the things that are coming out of your mouth, child. Babbling, insanity, delusions.
so. Yes, people probably do sneeze in their sleep. I did a little research on this, but Scott is correct that during REM sleep, we probably don't sneeze, which is odd.
Yeah.
But if you need to sleep or sneeze at that point, you'll wake up.
Right.
But
I think your brain wakes up if you're going to sneeze, but you don't sneeze while you're sleeping and stay asleep, I don't think.
yeah, well,
understand.
okay. So I'm looking at some research here. It says you may have no recollection of it, but there's a chance that you've sneezed in your sleep before. Sneezing in your sleep is possible, may occur at any stage, but there aren't that many studies. I mean, why would you fund a study on this, right?
Right.
But some evidence suggests that sneezing is most unlikely to occur during rapid eye movement sleep, and I do have a reference on that. And that's because of that phenomenon known as muscle atonia, where you're paralyzed during REM sleep.
Gotcha.
And, but people move between different sleep cycles when they sleep, so you can sleep in other, at other times. Now, I'm looking here. This is, and the page is not found. Okay, boo.
Have you ever heard anybody sneeze while they're sleeping, though? I don't think I ever have.
No, but
Not that I know of. Of course, if I'm sleeping, I would.
yeah, if you're
necessarily,
asleep, you wouldn't know it.
Yeah.
That's the thing.
I guess, yeah. Unless it's a hell of a sneeze.
Now, I cough a lot in my sleep.
Yeah, or you can have post-nasal drip. It can
Right, and I'm
cause you to
coughing.
choke and cough. Sure,
I'm coughing a lot.
But you
when
know,
I sneeze.
if in bed, there's still going to be pollen and shit flying around.
Yeah, of
You
course.
can breathe in that should make you sneeze, but you don't.
Yeah, this person says no specific sleep stages prohibit sneezing. However, during REM sleep, muscle activity is inhibited to stop us acting out our dreams. This might affect intensity or frequency of sneezing. So that's why it's generally thought sneezing during REM is unlikely, if not outright impossible. But again, who in the hell is going to fund this study?
Yep.
To what end? So there are some things we'll never know conclusively because there's no data on it. Why would there be any data?
The only way it's going to happen is if like Taylor Swift or somebody starts sneezing in their sleep, and
Then we would know.
Yeah, then
Right.
we'll do some
Right,
studies
right,
or
right.
something.
All right, very good.
Somebody important.
Okie doke.
Time perfect.
Yay!
Hey, Dr. Steve. Yes, this is the topic I know you've talked about a lot over the years, and that is the nocturnal emission or wet dream.
Yes.
And I probably had one or two in my teen years, none at all in my 20s. Now I'm in my early 30s, and I'm starting to get them frequently. And when I mean frequently, I'm talking about like 3 times a week. I live with my fiance. We have sex regularly. 1 to 3 times a week, I would say. but it's still happening.
Yeah.
I don't know what it is. If you can give me some advice other than, maybe beat off before bed or whatever, but this is happening and I'm kind of getting concerned because I'm not sure if it's correlating because I'm also not lasting very long in bed either.
Interesting.
Again, stamina, pretty good in my teen years and my 20s, not so much in my early 30s because, so I'd love some advice if you can, Dr. Steve and the panel, and mainly because I'm a little tired of washing sheets every couple of days.
I would be too.
Thanks.
Oh, just don't wash them. Little crusty sheets. What difference does that make? It's sterile.
Yes, it's clean.
It's
protein.
Yeah. So here's the thing. He's right. By the way, I started beating off at such a young age. I've never had a wet dream in my life. Never. Not one. So
practice, Dr. Steve, practice.
And I never completed the transaction in my sleep either. Whenever I started having a dream where I'm getting ready to have intercourse, it always ends just as things are getting ready to happen. So that pisses me off.
Dreams kind of emulating real life.
Yeah, maybe so. So, the ability to maintain an erection wanes over time. The refractory period increases over time. And generally, people will have reduced number of nocturnal emissions as they get older.
Right.
However, there are a couple of instances where this is counterintuitive. If they start increasing frequency in adulthood, it could be a reflection of a potentially significant sexual stimulation prior to sleep. So he said he's getting it a lot. Maybe this is a new partner. Okay. And if he's getting aroused, when they go to bed, even if they don't have intercourse, he may be completing that transaction during sleep. But what I'm also going to say is this can be a sign of hormonal changes as well. Yep. So I would get that checked and make sure that he doesn't have some sort of condition that's causing a dramatic increase in his testosterone or a dramatic decrease in other hormones that are, counter to testosterone. And so he needs to get that checked. Yeah. Just in case that's the only sign that he gets. Now, there was a weird study in 2020 that showed that those who watched more than 3 hours of TV today were more likely to experience nocturnal emission. And what the hell that has to do with anything? I don't know.
Hey, another couple questions, Dr. Steve, is maybe what is he wearing or not wearing to bed with his fiance? So, I mean, if he's changed from his old cotton briefs to some sexy silks or something, it's rubbing him the right way, or maybe they're just sleeping. Maybe they're sleeping in the nude. He used to wear underwear and then just having that little bit of stimulation for a man that age. That may be what it is.
Yeah. 41.8% of women report having at least one wet dream in their lifetime. In other words, having an orgasm in their sleep.
And the other ones don't admit to it.
Yeah. Now, regular sexual activity should decrease the likelihood of having a wet dream, but you can't definitively prevent them from happening that way.
And should increase his stamina, stick-to-itiveness. Which, damn it.
Oh, God.
I was just starting to wax poetic. Good luck, buddy. Check your hormones.
Yeah. Lord.
Hey, Doc. I'm 33 years old, 185 pounds. Just recently started the no sugar, no grains. Lost 10 pounds in 1 month. Feeling great. Yeah. So it's not bullshit. Question is about a vasectomy. Thinking about doing that. Unfortunately. And my question is that going to affect any of the hormones in my body, to turn me into a fat ass or to slow down my metabolism or anything sexual? I don't think it's going to affect my testosterone, I don't think. But any insight on that?
No, if it's going to affect anything at all, it's going to affect you psychologically. But when they do a vasectomy, they are tying the tube going from the testicle to the mechanism where sperm is admixed with seminal fluid that comes from the seminal vesicles and the prostate. And so sperm cells can't get in there. So when you ejaculate cell-free semen. Sperm, the stuff coming from the vas deferens is 2% of the volume. Mm-hmm. So if you had, 100 ml ejaculate, which would be a lot, then it would just be 98 ml. So you would never notice the difference. Right. And it doesn't change your ability to lose weight. It doesn't change your exercise tolerance. And the only thing, if you had a complication and you had pain in your, in that area, then, that might affect your ability to exercise for a while until you got it resolved. But other than that, no. Yeah, it should be totally fine.
And anymore, they're doing them so quickly and like minimal. Yeah, even no non-cut kind of stuff like laser.
And the yes, and they still cut. That's the thing.
Well, they cut going in. Yes,
they say no scalpel.
Then they do laser,
and it's a lie. Yeah. They'll say no scalpel, and I mean technically it's true, but the no scalpel vasectomy uses really sharp scissors or a laser. Yeah. Or any of these things, they're still cutting the scrotum. Mm-hmm. They're just not using a scalpel,
right.
The physical tool that looks like a knife. Mm-hmm. But they're still
going
using
in.
a knife.
They're still going in.
Yeah, so don't be fooled by that.
No, and it's going to hurt a little bit.
Yeah, well, mine was fine. I highly recommend go get a pitcher's cup. Mm-hmm. For real.
No, yeah. Those things can be handy.
Yeah, you get a pitcher's cup and you wear it, and then your nuts will not touch anything, and it's fun. You can walk around the hospital or whatever, and just take your fist and pound into your crotch,
he did,
and freak people out, and they hear. Like that when you do it. It's funny.
Oh, God.
I did do that.
Oh, my
You got your scrubs. How'd your vasectomy go? And I'm like, boom, 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 just punching my crotch. I can't feel a thing.
Oh, my word.
Yeah. Oh. Anyway, and no seeds, no nuts will probably help as well because there are phytoestrogens in seed oils, and Vinnie Tortorich has taught us that over the years. And what they're concerned. Okay, I'm going to ask for an extra minute because I'm doing another thing. The common omega-6 fatty acid, linoleic acid, they feel is converted into arachidonic acid in the body, and that may increase inflammation in the body. So that's why Vinny pushes the no seed oil stuff. So, canola oils and stuff like that. There are a lot of health warnings regarding that. A lot of the latest research doesn't necessarily back that up, but what the hell? I mean, there's a whole subreddit decrying the use of seed oils. I think it's fine. It's not going to hurt you to avoid seed oils. Mm-hmm. And the no seeds, no grain thing is a decent way to lose. It's a decent lifestyle that you can keep up to help lose weight, and it's reasonably healthy if you do it right. Okay? I relinquish my time, Mr. President.
Thank you. 16 seconds left to go.
Oh, yes, Dr. Steve. I was trying to call and talk about my 3 testicles.
Okay.
I have 3, count them, 1, 2, 3 testicles. I was born with 3 testicles. I was wondering if you ever heard of anyone.
Of course.
That had 3 testicles, such as myself. Apparently you're too busy playing some music.
What?
Hey.
What? Wait a minute. What? Hang on. Don't start the timer yet.
You're too busy playing some music.
Okay, I don't know what he's talking about there. All right. The presence of 3 testicles is called Triorchidism.
Orchidism.
Yeah. So if you have orchitis, then that is inflammation of the testicles. And so 3 orchids would be Triorchidism. Okay. Yes, that's right. Triorchidism. Good Lord. So anyway, there is a whole group of these conditions called polyarchidism, and these are people that'll have more than 2 testicles. It's rare, and it's caused by an abnormal division in the genital ridge when we are a fetus. Now, I challenge him to determine whether he really has 3 testicles or what he has is what double vasectomy Todd had, which was a spermatocele.
Okay.
He had a cyst that was filled with vesicle or vas deferens fluid that looked and felt like a testicle, but it was not actually testicular tissue. Now, a lot of times these people will have inguinal hernias. They may have a testicle that doesn't descend properly. They can have torsion. Mm-hmm. They can also get hydroceles, and then they can get hypospadias, which, if everybody remembers, that's what Bobo had, where the urethra doesn't open up at the end of the penis. It opens up on the bottom side of the glands. Okay. And usually these people have a mass in the scrotum, and they do a Doppler ultrasound, and then you just avoid surgery. They should be followed up yearly by ultrasound for life, just to make sure that something else hasn't happened.
Cancer or something.
But if it's a hydrocele is filled with fluid, clear fluid, also can sometimes feel like a third testicle above one of the testicles, and then the spermatocele is filled with fluid, but it's
thick.
It's vas deferens fluid. Okie doke.
Yeah.
So if you haven't done it, you need an ultrasound of the scrotum, and then go from there.
Right on.
And I'm going back to play some music. So,
back on.
25 seconds
Because you're too busy playing music.
At least he called it music.
Yeah, that's true. Yes. Oh, I guess maybe he's talking at the end of our show. For those who are not aware,
about to rock,
we play something that we refer to as music at the end of the YouTube recording, which you can join us at youtube.com/@weirdmedicine. If you see it live, you can see the music there. Otherwise, it's on our Patreon. So I can just torture the poor people who actually pay for content, and I send that stuff over there and call it the dregs. And I'm sure that just seems disrespectful, but it's it's content that nobody else can see. Anyway, but yeah, do check out our Patreon. We're doing some other things there as well, not just throwing shit that we don't want other people to see. Really, what it is we get these copyright strikes. Yeah. And then we can't monetize the regular video. So we're not really doing a video podcast, but we do a radio show that we record, that we, turn the cameras on so people can sort of see behind the scenes. So we're not really trying to do a live stream sort of situation. But anyway, but you're welcome to join us. Okie doke. Next.
Hey, Dr. Steve, Dr. Scott, Casey.
What's up?
You guys are doing a great job. I really enjoyed the speeded up comments. I still think for Casey to enjoy it, you need to get like one of those bells like they.
Oh, did we do this one
I think
before?
we did this one.
About organ donation? Okay. All right. Yeah. Okay. Sorry. Well, anyway. All right. Oh, yeah. We did this one too. Unlimited funds. Okay. White blood cell. Okay. Let's try this one.
Hey, Dr. Steve, it's Dr. W here. Another
No, we did this one too. Damn it!
Yeah, way to go!
I didn't delete any of these from last week. This is what I did.
I'm just glad he wasn't suggesting give Tacey a taser or a little, put a little electric shocker around her ankles.
When I was a kid, there was a movie called The Tingler. And it was a Vincent Price movie about this thing that would get in your spine. And what they did, the gimmick was they put this thing in everybody's seat in the theater, and during certain parts of the movie, they would hit a button and everybody get a shock on their ass.
No.
Yeah, absolutely.
Oh, my word.
Yeah, if Kaylee from Once Over with Kaylee did a thing about it. And
oh my gosh.
I told her I was probably the only person that watched that video of hers that actually sat in the theater. And I can't remember what they called that, that device. But what if we got something like that?
Oh my
and then you could
gosh.
shock us.
I'm afraid she would probably abuse her privileges.
Yeah, let me see.
I think she would enjoy it way too much.
I do like to yell Tom. So.
The creature earned its name by making the spine of its host tingle when the host is frightened. And let me see. Released in the United States, the Tingler received mixed reviews. Yeah, it was pretty terrible. But it's gone through critical reevaluation, is now considered a camp cult film. And I'm just trying to find here if they showed what that thing was called. But anyway, okay, gimmick. William Castle was known for his movie gimmicks, and the Tingler featured one of his best. It was called Percepto. Previously, he'd ordered a $1,000 life insurance policy against death by fright for Macabre, which was a movie, and sent a skeleton flying above the audience's heads in the auditorium in House on Haunted Hill. Wow, the gimmicks for the Tingler increased the film's cost from $400,000 to $1 million. But the gimmick was called Percepto, and they attached electrical buzzers to the underside of some seats in the theater where the Tingler was screened. Percepto, with an exclamation point after it. Things were just so much simpler back then.
That's pretty cool.
Anyway, okay, this does not count as, where were we? Okay, well, we're not answering a question. All right, let's do this one. So maybe we could consider that. We could do something that would be a consequence. If we go long, Tacey pushes a button instead of just screaming, Tom, into the...
I think she enjoys the yelling time at us.
Yeah.
And seeing us both.
I could give you a stream deck over there where you could push different buttons and do buzzers and stuff too if you want. Okay, all right.
Hey, long-time caller, first-time listener. Wait, that's backwards. Anyway, it is getting into poison ivy season.
Oh, bite your dirty
I just
tongue.
hate that shit.
Yeah, it makes three of us.
What's the best course of treatment for dealing with poison ivy other than just keeping your ass away from it?
Well, that won't even help you because poison ivy is caused by a volatile oil on the surface of the plant. And on a still day, if it's hot enough, that oil will, turn into a gas. Mm-hmm. And if you walk through that cloud that's just sitting there on a very still day, you can contract poison ivy because it is dosed in parts per billion. Mm-hmm. Now, people will think that they scratch it and it spreads. That's only true if you haven't washed yourself in the last week, because soap will get rid of the oil. It is soap soluble. But what really happens is if I have 10 parts per billion on my wrist and 1 part per billion exposure on my shoulder, on my elbow, for example, then the 10 parts per billion area will come up first. It's called a delayed type hypersensitivity reaction. Blisters, itching, redness.
Miserable.
And then it will work its way up, and the 1 part per billion will come up maybe 2-3 days later. And so it looks like it's spreading, but the exposure was all at the same time. So if you know you're exposed, washing, and they used to say octagon soap, it doesn't really matter. Any soap will do, but wash yourself thoroughly. And then if you do contract it and it's severe enough, it's blistering and the blisters are bursting and you just can't stand the itching, then your primary care provider or a dermatologist or really anybody could prescribe a steroid dose pack. That really, the first time I had a steroid dose pack for a poison ivy attack, it was like sweet, sweet relief. Within a day, the itching was gone, and now you're tempted to stop taking the medicine. Don't. You got to finish it. And, by the end of it, it was completely dried up and done. So that's really the thing. But the prevention is the key. And don't burn the shit.
No, hell no.
I've seen places where, at campfires where people were burning poison ivy, don't wipe your ass with it. So which means number one, it's 2024. If you're going camping, bring toilet paper with you. Don't be wiping your ass with leaves anymore. It's first off, you're just leaving stuff behind.
Biodegradable toilet paper.
Yeah. Yes. Exactly right.
Don't camp.
Or don't camp. I like that.
Yeah.
And I used to have a sun shower. It's just you fill it up with water, you set it out in the sun, it's black, and then you have a nice hot shower. And you could actually use it as a bidet if you really were smart and figured out how to do that. So
just do a handstand.
Yeah. Yeah, there you go. Okay. All right.
10 seconds left.
Woo.
Good job.
Hi, Dr. Steve. It's Artie from Pennsylvania.
Let me tell you one problem with this, Tace, is we need a shitload more phone calls if we're going to do one every 3 minutes. That's all I'm saying. I like the format, too, but it...
We're going to have more Tasty's time.
Yeah, give us a call, 347-766-4323. Leave your voicemail questions. I don't care how stupid they are. We need a lot more questions.
We will answer them in less than 3 minutes.
If Tacy is going to enforce this bullshit policy of hers. All right, there we go.
I have this pressure beneath my eyes and the bridge of my nose. And
we did this one.
We did?
Yeah, last week, yeah.
Okay, damn it. Okay. All right.
Yeah, we'd like to have a follow-up on that guy, though, to see how he, if he did go ENT or whatever.
Okay. How about this one?
Hi, Dr. Steve. My name is Jeff. I've been diagnosed with Castlemans Disease, and I'm not really sure exactly what that is or what I should do more about it. I had surgery on my neck to remove the lymph node, and nobody around in this area seems to know anything about it. Just be interested in your opinion on it.
Yeah.
I appreciate it. Thanks. Bye.
Okay, we usually try to, avoid rare diseases and stuff on here because it doesn't have a real, general interest. But in this case, particularly, Castlemans disease is an extremely rare disorder, but it causes lymph nodes to enlarge. And these people will often think that they have lymphoma or something like that, but they actually don't. And sometimes you can have just one lymph node in the chest or the abdomen, then they'll have this thing called multicentric Castlemans disease. It's lots of lymph nodes throughout the body. And now, if they have lots of lymph nodes, they can have fever, weight loss, fatigue, that kind of stuff, all things that, again, would make you worry about having lymphoma. This isn't contagious. It affects people of all ages. And there is a treatment for it called siltaximab. And it takes care of the majority of cases and induces remission in almost everybody. So check that out. You would still want to see a hematologist because they're really the only ones that deal with that stuff, with the monoclonal antibodies. And there you go. So Castlemans disease. Pretty interesting syndrome, and but they usually do very well. And if you have the unilateral or the unicentric one, where you just have the one lymph node, and they remove the lymph node, you're fine.
Oh, good.
All right. Okay. It does need to be treated. In really bad cases, it can lead to some problems down the road, including infections. Yes. Organ failure, stuff like that. So
and suppressed immunity.
Yes.
Yeah.
All right.
Okay. Oh, 1 minute, 6 seconds
Hey, Dr. Steve, how are you? I'm in my late 30s now, and everything hurts all the time.
I'm ignoring you, Tacy. So
I'm not complaining, that much. But the question that I have for you is, why is testosterone, HGH? Why are these things illegal? Bodybuilders get it all the time.
Okay, we've answered this question before, but it's a good question. And the reason they're not illegal; they're just illegal to obtain without a prescription. And the reason is that there are downsides to it. Testosterone is is on the DEA drug schedule. It has to be prescribed. And I've seen people that did the cycles for bodybuilding and then ended up with a testosterone of 0, literally 0.
Jeez.
Because I've never seen it in anyone other than somebody that was juicing,
right?
And they end up with a suppression of their of the shit. Andy, don't use this one on our shorts. They end up with a suppression of the testicular function, and the testicles just shut down. They go, why are we even here? There's plenty of testosterone in our system. And so they just go to sleep, and then sometimes they don't wake up.
Yes.
Testosterone of 0. So you can imagine, we talk about low testosterone on this show, what a testosterone of 0 would look like. So you don't want that. Then there are other things like, roid rage is a thing. Acne is a thing. Increasing your risk of heart attack and stroke is a thing if you get those levels too high for too long. So, we can argue whether people should have agency to do what the hell they want to with their bodies. I'm in favor of that, but I'm just explaining why these things currently are illegal. Okay?
Yeah, did he say anything else about why he has aches and pains all over?
No, I'm wondering if he thinks he has low testosterone. It's perfectly legal to treat that.
Right.
If you have low testosterone.
It's a pretty easy test, too.
You go get tested, and you get treated. And if the prescription stuff is too expensive, go to a compounding pharmacy. They can make you testosterone aftershave and all kinds of stuff for about $50 a month. All right? All right,
guys.
41 seconds.
Oh, okay. Well, could you hear the music? We're
over time.
We're stopping anyway, but thank you, Tace. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Time!